Have you been told that you have a herniated disc, your back hurts, and you have radiating pain going down your legs? This video is going to help you by showing you at-home relief for a herniated disc. And I'm also going to explain to you what exactly a herniated disc is, because knowledge is power, and knowing what's going on with your body can empower you to be able to address and effectively fix what's going on with your body. So let's jump right into what a herniated disc is. It's when the disc that separates your vertebrae begins to move in a posterior direction or starts to poke on your spine, your spinal cord in particular, and that can cause radiating symptoms down to your back because of the nerves that are being pinched, but it also can cause aches and pains to the joint itself, as well as to the muscles and the ligaments that surround your spine, because there's going to be increased pressure that's placed on them for prolonged periods of times. And for people who sit for long periods of times, maybe you're somebody who's a truck driver, you sit and you work in IT or in different fields where your spine might be in a position that causes you to encourage a slouch position or posture, the disc can begin to herniate, especially if you don't have strong core and abdominal strength, or you have a little bit more of excess abdominal, whether we want to call it fat or what they call dad bod, beer belly, all those different kind of things. A little bit more abdominal tissue in that area is going to cause more stress and strain on your back, which can lead to herniated disc. So how do we relieve this at home? Well, one of the things that is helpful, what we teach our clients and patients to do, is understanding that the same things you do for treatment can also be used as a test to assess what exactly will be the most effective treatment for you. So I want to show you this from not only the perspective of treatment, but also from the perspective of testing and assessing what are the motions that actually cause relief for your herniated disc, and might even be used in a test and an assessment when we're looking for people to actually diagnose whether they actually do have a herniated disc or maybe they have sciatica, because those things feel the same and they're located in the same areas, but they're actually different and are going to use different treatment methods to actually help you get long-term relief. Let's show you this right now. First exercise is called a lower trunk rotation. So one of the things we want to be able to do with this exercise is, as we're on our back, simple thing you can do from home, bending those knees and having your arms by your side. You can have them here, crossed, different things, but the point is that we're having our knees bent and we're going to drop our knees down to one side. What's going to happen is it's going to create a torque on the spine and a rotation that also helps to begin to extend the spine. This is going to stretch the hip area as well as the lower back. We can drop and alternate to the other side. Now, one of the things you want to do that most people don't realize is that as you're doing exercises, number one, not all exercises are for everyone. That's an extremely important thing to realize, because sometimes people think that more pain means more progress, but that's totally incorrect. So doing an exercise like this or any exercise that increases your pain is actually not productive, especially if you're having a reproduction of the same pain that you usually feel that you're trying to fix. So one of the things we have to do is distinguish, well, what am I feeling? Do I just feel like a general tightness or maybe a discomfort because my body's not used to this position? Or am I feeling a reproduction of the same pain that I usually feel? Or am I feeling a reduction of the pain that I usually feel? This is extremely important to distinguish. What exactly are you feeling? And this is where we mentioned that what is done for treatment can be used as a test and assessment at the same time, because if this is feeling great for me, it's actually giving me an indication of what exactly is going on with my spine and where the limitations are and what may be some of the reasons why I have that limitation. So one of the things you might do is holding that exercise for 3 seconds on each side, doing 5 seconds and things like that, but you only want to begin to use it as an exercise to relieve your pain if it actually relieves your pain. So does it reproduce it? Does it reduce it? What exactly does it do for you? That's an important thing to monitor and to observe, to even understand if one, that exercise is for you. And guess what? Not all exercises are for everyone, but also not all exercises are for everyone at all times. That means an exercise that reproduces your pain today by you doing some other exercises that are more necessary in the immediate time frame, that exercise that used to reproduce your pain might in the future reduce your pain if you do the right exercises prior to that. So these are important aspects. But if you have a herniated disc, another exercise that's going to be extremely important, let's show you, is our back extension. So we're going to be here and we're just going to extend just like that. Really simple exercise. Now, one of the first things I want to do is see what happens when I lean back, holding it for a few seconds. And if I do 10 repetitions of this and I feel a relief to my pain, that's really valuable information, not only from a test, perspective, but from a treatment perspective, because then if this actually helps me when I'm testing to see what positions of comfort help my back, it's also instructing me not only that I can use this exercise as a treatment, but other exercises that are similar as a treatment. And so working with us as physical therapists or rehab specialists is really important for the reason that we can help point you in the direction of other exercises that may be more comfortable, that are also similar. So maybe doing this exercise really relieves the pain. You feel some relief there. That's really amazing. That's great. Another way that you can do this exercise is by going on your tummy. Now we're on our stomach and we can do what's called a prone press up. Let's press up. And what we're actually doing, we talk about this in the form of squeezing the jelly-filled donut and pushing that herniated disc back into position. And we want to train it for a long period of time in terms of having an exercise regimen. So what we're doing here is, because imagine if my spine being in this position, and I'm kind of over exaggerating here, but imagine the discs that sit between my hard vertebrae, you know, your spine, the hard part, the vertebrae, they're actually discs that sit in between these hard little ridges. And when that begins to poke out like a jelly-filled donut, it kind of is poking on and against your spine and other tissues. But when we go into this opposite position, we're actually going into a corrective position. So it's not only this exercise that could be beneficial, but other exercises that help to move my spine in a similar direction is going to be very beneficial. And I can do this. Again, we can think about 3 to 5 second holds, relax. And I want to do this to the degree that it relieves the pain. So those are things that you want to think about and hold that position. So this is at-home relief for herniated disc, but these are also some of the things that from a treatment perspective, we're going to train and examine and assess and test and see, do you truly have a herniated disc? Because sometimes people may have been diagnosed with a herniated disc and they've been told they're never going to get better. But what they don't realize is that there are actually things that can help them become better, or they may actually be diagnosed with something that is different, which is sciatica or other lower back conditions. So if you found this video helpful, not only should you like it and leave a comment, but you can look at our playlist on back pain and sciatica, which can help you to begin to distinguish the differences and help you to understand what's actually going on with your case. And the best part about this is you can hit the link in our description to talk to a PT first, where we'll give you a free conversation to help guide you on some of the questions you might be having about your diagnosis and the best treatments that are going to help you to relieve the pain long term. And again, I hope you enjoyed this video. It's Dr. Toby here, and subscribe to our channel because we make videos to help you discover the wealth that starts with your health by helping you to become healthy, pain-free, fit, and mobile. And guess what? I can assure you that there are things people told you that you'd never be able to do again that you will be able to do when you start to discover the wealth that starts with your health. So subscribe to the channel, and I can't wait to see you guys in the next video. See you later.